A baby is something very special, bringing joy and happiness to life. In most cases, a certain routine soon develops through day-to-day interactions. But especially during the first weeks of life, there will also be situations where parents feel uncertain and out of their depth. Well, the critical moments occurred when she still hadn't settled, even after 3 or 4 hours, and just kept nodding off briefly, only to wake up screaming again. She always had to be carried until she fell asleep. She always started by screaming and didn't calm down. At first, this really was a kind of shock.
The most difficult thing for me was, above all, the helplessness and the powerlessness and the feeling of having no idea.
However, extended and frequent crying is not unusual during the first weeks of life.
Babies cry because this is their very normal way of expressing themselves in order to say, I'm not well, I need help.
It's important parents know that babies don't cry because they're naughty or because they reject their parents. They're not capable of this.
And it's nobody's fault. It's neither the baby's nor the parents' fault that the baby is crying at this time.
Babies can be hungry or thirsty, overtired, have a full nappy, be wet or too cold or too warm.
But sometimes we can't find out what the reason is. Then all we can do is stay there and get through it. If a baby is impossible to settle, it can be exhausting and nerve-wracking. Feelings such as helplessness, powerlessness, or anger may arise. Then often all we can think about is that the baby should stop screaming. In their desperation and sometimes out of anger, some parents end up shaking their baby. But this can have massive consequences.
Shaken baby syndrome is a severe type of brain damage caused by violent impact, namely shaking. The brain flies back and forth in its hard bony shell, is bumped and internally compressed and stretched. This leads to torn blood vessels and superficial brain hemorrhages. But even more crucial is probably the fact that it leads to numerous injuries to nerve cells and nerve connections, to brain tissue dying off and to a short-term disruption to breathing, which in turn leads to oxygen deprivation. These forces cause irreparable brain damage, often leading to lifelong disabilities and, in some instances, to death.
However, losing control can be prevented. If you notice that you are reaching your limit, lay your child down safely, leave the room briefly, and take a deep breath. Check on your baby every few minutes. If necessary, seek assistance from your family or friends, your midwife, or a counseling service.
Normally, such intensive crying phases last through the first 3 or 4 months. With some children, they may even last a bit longer, but most children stop crying with this kind of intensity during the 4th month.
If you're on the ropes the whole time, and then it suddenly seems that something's actually happening, it's an indescribable feeling of joy.
The nice times have taken time to arrive, but now they're here, they're all the more enjoyable for it. You can find further information on the topic of shaken baby syndrome and about support services near you at etensein.info.